Good afternoon, Berkeley, and thank you for joining us for this virtual town hall on the City of Berkeley's response to COVID-19. I'm joined with a great panel of city leaders, including our city manager, Dee Williams-Ridley, who is acting as the Director of Emergency Services during this state of emergency, our City of Berkeley Health Officer, Dr. Lisa Hernandez, and our City Auditor, Jenny Wong, who's going to be talking about a recent report that she had released around the economic impacts of COVID-19 on our local budget and how the city should begin to prepare to address what we know are going to be challenging economic times. So I want to thank you all for joining us, and thank you to the many Berkeley residents that submitted questions. We're going to get to those questions after each of our panelists give a brief presentation. But just to put today's town hall into context, and I know Dr. Hernandez is going to talk about the local cases, but globally, we have 2.7 million people who have tested positive for COVID-19, and 196,000 people have died from this deadly virus. And so it's in that context that we start our discussion today, in memory of all those people that have died from COVID-19, the many families that have been impacted by COVID-19, the frontline medical staff and first responders that are out there every day working to treat the sick and to keep our community safe. And I want to take this opportunity to once again thank our amazing city staff, our city manager, our public health officer, our staff in the Emergency Operations Center, our city auditor, and our first responders and frontline staff that are serving the homeless, that are treating the sick, and that are making sure that our city continues to run during this difficult time. And I'm very proud of our community because we have really rallied together. We're looking out for each other, and we will get through this and we'll be even more stronger and resilient as a result. So we're going to talk a little bit about the city's work in responding to COVID-19 and also to think about the future. And I think a theme for today's town hall is what's next. Not only what is next with the shelter-in-place order, but what will happen after? How will our city and how will our world be forever changed? And how will we have to adjust to this new reality? How will we be able to address the fact that we know that our global economy and our local economy has been significantly impacted by this pandemic? How are we going to make those difficult decisions to make sure that we can continue to provide essential services for our residents? And how are we going to work to rebound our economy and to get people jobs and to make sure that we are on strong economic health? And how are we going to adjust to the fact that even after the shelter-in-place order is lifted, that the risk of people contracting COVID-19 still exists. And so we will need to take the health precautions very seriously, and that will be difficult. But at the end of the day, this is about saving lives and keeping our community safe. So I want to thank all of you that have been following the directives to stay at home to save lives, who've been wearing facial coverings, who have been practicing physical distancing because it is helping. It is helping reduce the spread of COVID-19 in our community. So with those sort of introductory comments, I want to turn it over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, you want to provide an update on number of cases in Berkeley at this time, and anything else you'd like to share with the Berkeley community.
Great. Thank you, Mr. Mayor. I appreciate the leading with thanks to the community and thanks to everyone within the community and also within city staff and our partners for helping us respond to numbers in the United States. 760 cases of confirmed of COVID-19. The deaths are over 50,000. So there's 50,439 deaths. In California, there are 39,254 cases with 1,562 deaths. In Alameda County, there are 1,354 cases and 47 deaths. In the city of Berkeley, we have 49 confirmed cases and 1 death. Last week, I believe I started reporting on the number of tests that are performed for City of Berkeley residents. I'm going to continue to report on that. That is also on our website. We have had 854 tests performed on City of Berkeley residents, and that's in any lab, in any site, but with the numbers being specific to the City of Berkeley residents. And when we look at that, we also look at the positive rate of positivity in those cases. So how many of what percentage of those tests that were performed are positive, and we're seeing a 5.5% positive rate. In terms of data, again, I want to remind you that they're on our web posted. We have on the open data portal the cases and the testing data that you can look at by day. So that's available, and that's updated Monday through Friday. We're hoping to have that dashboard up early next week. Otherwise, we are also using, of course, Alameda County's dashboard for data. I want to focus on vulnerable populations, the population that is biggest hit by COVID-19 in terms of complications and sometimes even fatality. We are working we have a task force in the Emergency Operations Center, which is focused on skilled nursing facilities, homeless population, older individuals. We are working with the shelters on their infection control policies. The masking order that I released last week applies to the facilities where individuals who are homeless or experiencing homelessness are sheltered. So they are aware of that. Our skilled nursing facility task force specific group continues to communicate with the facilities weekly, and we're provided with a daily status of the skilled nursing facilities. I completed, along with fire, visits to each of the skilled nursing facilities to tour, as well as provide feedback and answer any questions to them in terms of the shelter in place order and the masking order and any other issues they have. The communicable disease outreach team performed over 50 outreach efforts at different locations throughout the city to provide information to those that are underserved or are not easily accessing medical care or information. They will continue to do that next week. They're individuals that speak both English and Spanish. And also we've been pointing the community to our nurse triage line, where there is a nurse who can answer questions and also help schedule testing for individuals. Again, that is a bilingual service. In terms of testing, I agree with everyone who's said we need more tests. We're not there yet. However, we're phasing and expanding the amount of tests that are available in the community. Some of those are through our efforts from the City of Berkeley, but also through other providers in the community. Right now, for our approach is still focused on symptomatic individuals, especially those that are high risk and are underserved. The nurse, as I mentioned, the nurse triage line is helping expand that access. And my plan is to expand that access in phases so that we are able to serve every person who is symptomatic in the community. Last thing I wanted to talk about is, before I go to that, I want to talk about our staffing. People are wondering, you've heard in the news that we're increasing testing and that we need to do contact tracing. We always do contact tracing. And what that means is that when we get someone who is a case, we interview that individual, find out who they've been in contact with, who they've exposed, and then we reach out to those contacts. So that is part of contact tracing. And we also isolate the case, and then the individuals that have been exposed, they are quarantined, which means that they have to restrict their movements as well. As we see more cases, we will need more staff. And that is something that we're actively already increasing our staff perform those core functions, and we're continuing to add more. So I just wanted to let you know that is happening. We will continue to do that. This is a core strategy to allow us to contain and respond effectively to COVID-19. Last but not least, the shelter-in-place order. I know people are hopeful and are wondering when the order will be released. Our plan as a regional health officer group is to release those orders and information on those orders early next week. We're meeting multiple times a week. Actually met this morning. We'll meet again later this afternoon. So we're actively working to get those orders out. We are aligning with factors that will allow us to move forward with lifting restrictions, and we will provide that information as soon as possible. We do know that, as Mr. Mayor mentioned, this is a new reality for us, and we will know that our operations will be different. How we interact with each other will remain to be different, especially because we do not have vaccine and we do not have a regularly proven medications for treating COVID-19. That's the end of my report. I look forward to answering other questions that come up today.
Thank you very much, Dr. Hernandez, for all your work. I now want to turn the floor over to our city manager, Dee Williams-Ridley, to talk about the work of our city of Berkeley administration in responding to COVID-19 and city operations. Madam City Manager. Madam City Manager, I believe you are muted.
Righty, there we go.
Yes.
Thank you very much. Welcome, Berkeley, and thank you for joining in on the call. I want to also thank our community for just stepping up and making sure that we're leveling that curve out and working really hard to make sure that people are safe. Along with our mayor and elected officials, I just want to thank the mayor for this opportunity and making sure that we connect with all of you. And having Dr. Hernandez here is really a plus because she is super busy out there, and I'm very proud and very happy, and welcoming our city auditor. So thank you, City Auditor, for your work in helping to support our city. With that said, I do want to just highlight a few things that are new and what's going on with our Emergency Operations Center and how we're resetting on what we need to do moving forward. So our focus has been in 3 areas, well, multiple areas, but 3 that I want to talk about today. Number 1, post-COVID-19. How are we planning to move ourselves forward? Number 2, homelessness. And I think Dr. Hernandez has talked a little bit about that, but we have some work to do in that arena. And I want to assure our public on some things that we'll be doing in regards to that. And then thirdly, just to kind of share what we're doing around continuing services for the community and how we move through this in transition. So in terms of post-COVID-19, one of the things that we're doing is we've assembled a team of expert staff and folks internally to work on a post-COVID-19 plan. That plan will include documenting everything that we've instituted from January at the first onset of the virus in terms of activating our EOC to date. And we're documenting that information so that we can learn lessons, so that we can work on any future needs around EOC activations in the future around COVID-19, and also to start talking about how does this look different for us as a city and how do we plan for what we will be in the future. Our post-COVID-19 plan will include a number of things. Number 1, recovery. Our goal really is to figure out how to vigorously pursue cost recovery efforts so that we can secure as much as we can in terms of alternative resources that relates to revenue, capitalize on federal and state opportunities and assistance. That is our goal, and we have a full team that's just dedicated to looking at that. Sometimes it's really difficult to navigate FEMA restrictions and requirements, so it's really important for us to be ready and have things ready to go when the time comes for us to pursue those funds. We will also be focusing on long-term sustainability, particularly that type of sustainability that aligns us with who we are as Berkeley, and make sure that we have available resources moving forward. So that's post-COVID-19. It will be a full plan for the city, and we're starting to develop that now. Also, in terms of our unhoused community, In Berkeley, we've seen an uptick on encampments throughout the city, on just garbage and debris around our city, downtown, other areas. And we have assembled a team that will be beginning on Monday of next week. We're going to be assessing throughout the city what needs there are and taking along with us public works staff, public safety staff to start cleaning up, getting up debris around the city, especially in the downtown and some of the corridors that are adjacent to the downtown area. Because we believe that with the garbage and debris that's out there, that's a health and safety risk. So we want to make sure that we keep our streets clean. And also look for areas where we need to populate more hand washing stations, more restrooms, just so that we make sure that we're addressing the needs of our community. We're not asking our community members to remove their tents. We are asking for them to move them off of the sidewalks. But we understand that people that are asked to shelter in place, some of us have homes to go to, others do not, and those are tents. So those folks have to have some kind of way to shelter in their space, in their place, which could be a tent. So we want to provide them with the resources so that they can, number one, make sure they clean up our city, keep it clean, and also have resources that help them to reduce the spread of the virus. And then lastly, I want to just thank our city EOC team. It's being led by Paul Budenhagen, our deputy city manager, and I really want to credit him with an amazing execution and leadership in our EOC. He's there every day working with our staff and team members, and they are lifting up multiple shelters, homeless environments, individual living spaces for our unhoused community. We've lifted up additional showers, we put out additional porta potties, hand washing stations, and I'm just really excited about the work and the connection that's being made out there with our homeless outreach teams with the unhoused population. So look for more of that. We will be doing more outreach in our neighborhoods and out there in our unhoused and community environments and making sure that they have their needs. One of the things that's come up for our unhoused community is now that you have a number of businesses that are closed, people are actually having food insecurities, more so than normal. Normally we have huge amounts of community outreach that goes out and provides food. So we have been working with multiple local community-based organizations in helping to provide more resources and food to our unhoused. So I want people to know that we're working on those things and we've already implemented a number of them, and we'll make sure that we bring those services directly to our unhoused as well. So I want to thank the mayor again, and I'll turn it back over to you. Thank you.
Thank you very much, Madam City Manager. We are joined this week by our city auditor, Jenny Wong. And I want to thank you, Auditor Wong, for participating in this town hall today to brief us about the report that you recently released on the economic impacts of COVID-19. Not only nationally, but also on our local budget. And I'm wondering if you could share a little bit about your report and the findings of your report and what steps the city should take to ensure that we can get through this, this difficult economic period.
Sure. Thank you so much, Mayor Arreguín, for inviting me to this town hall. I want to first pause and thank you, the council, our city manager, Dr. Hernandez, our department heads, and all of the city workers dedicated to responding to this emergency pandemic. I also appreciate the patience and kindness of wonderful Berkeley community. Today, I'll present an overview of our recent report titled Navigating the Impacts of the COVID-19 Pandemic on Berkeley's Finances. I'll go over the purpose of the report, discuss the impact on Berkeley's economy, the revenues and expenditures, and offer some considerations for decision-making. The economic impacts of the pandemic are deep and potentially long-lasting. This is going to have a significant impact on the city of Berkeley's budget. My intention is to make sure that decision makers and the public have information about the full scope of the potential impacts so that we can better this economic downturn, provide for the public health needs, and continue to provide the most essential services and protect our most vulnerable. Berkeley, unlike some other cities, has a reserve fund and a strong policy passed by council in 2016 based on a city auditor report which can help us through this crisis, but it must be managed for the long term in the event that this downturn lasts multiple years. As the pandemic hit, I saw right away that the closure of local businesses, the university, and increased unemployment would have a significant impact on Berkeley's budget and finances. I wanted to make sure that there was information to address the unfolding economic situation, so I put some of our audits on hold and dedicated my staff to compiling information to provide a better understanding of how this would impact the city of Berkeley's budget. This report was put together under Caitlin Palmer, who led the report with team members Farhad Askarov and Tracy Yarlott Davis. We conducted research and interviewed government and finance experts, as well as other cities, to develop a report, a high-level overview of potential budgetary impacts. Our report is intended to be complementary to additional information being developed by city staff, including specific budgetary projections. I want to thank the city manager, the deputy city manager, the budget manager, and the finance director for their consultation. So the key takeaway points from this report are: one, the pandemic has had a sudden impact on Berkeley's economy, increasing unemployment, disproportionately impacting low-income and vulnerable populations, and the closure of UC Berkeley has dampened our economy. Two, revenues will decrease, and the extent to which we will see the revenue loss depends on the severity and the duration of this pandemic. And three, regarding expenses, we will see an increase in some areas in the pandemic, but because we will see decreased revenues, the city needs to plan to make expenditure reductions and take a long-term view in their planning. Let me talk a little bit about Berkeley's economy. With widespread unemployment nationwide and in California, Berkeley is no different. Based on data we found in early April, there could be 27% or more workers who live in Berkeley at risk of losing their jobs. And unfortunately, many already have. We will also be impacted by the closure of UC Berkeley, which employs over 23,000 people and brings about 43,000 students. As of April 10th, 1,000 students out of 7,000 remain in university housing. This doesn't include students in housing outside of university housing. Further, it was brought to my attention that the loss of students will also impact census responses and therefore impacting future aid to the city of Berkeley. We know that the pandemic is disproportionately impacting low-income workers and vulnerable populations' ability to afford basic necessities, including affording rent, and as the city manager has pointed out, basic needs like food. We also know that COVID-19 is greatly impacting small businesses and arts organizations, as we can see visibly throughout the city and evidenced by the number of applicants for the Berkeley Relief Fund. I want to point out that this economic downturn is different from the recession in 2008. This was a sudden halt to much of our economy. Second, the situation is more volatile because the public health risk is driving how and when the economy will reopen. Now, a bit of good news is that the city of Berkeley is in a better fiscal condition to weather a recession than it was during the Great Recession. The city does have a reserve fund, which currently has a balance of $36 million. The bottom line in terms of Berkeley's economy is that we're headed into a recession or even a depression, which will affect state and local funding and revenues. And while the federal government has provided funding in some ways, including some relief for individuals and small businesses, there has been no funding provided for cities 500,000 in population or less, and Berkeley is in that category. This means unless there's future relief for those that are excluded in previous bills, it will fall on the state and local governments like ours to address those unmet needs. So let me now turn to the impact on Berkeley's revenues. Now, the main sources of Berkeley revenues will decrease, and those include sales and use tax, revenue from business licenses, transient occupancy tax, parking fines, and property transfer tax. Berkeley may feel the impact of sales tax more deeply than other cities because restaurants make up 25% of sales and use tax in Berkeley compared to 16% statewide. We also need to consider that some actions the city has taken to assist small businesses and residents will impact revenue. For example, temporary stoppage of refuse services and not charging fees at parking meters except for the safety risk will decrease our citywide revenues. What's important to note is that the timing of these revenue streams they're not at the same time. So we will see a sales tax impact much more quickly, but we might not see the property tax reductions until a lot later. The finance department will have specific estimates of these revenue projections, and we recommend that regular updates be brought to council and the public because those numbers will change depending on the length and intensity of this downturn. While we may get funding in the future for some COVID-19 response activities and others, we may get other state aid, for example, for homelessness, we have been told that federal and state funding to cities will likely not be enough. So with decreased revenues, what does this mean on the expenditure side? First, some expenditures will increase depending on the severity of the outbreak, the cost of running the Emergency Operations Center, the cost to protect public health and welfare will increase. And you've heard about the myriad of responses by the city to address this emergency, from setting up our testing site, to placing unhoused residents into shelters, into homes. Additionally, we will see healthcare and retirement expenditures in the city likely to increase. The big picture is that we will see some costs increase. The city of Berkeley will still need to reduce expenditures overall to balance the budget, given that we will be receiving less in the future. So how can this be done? We gathered a lot of information and spoke to a variety of government, finance, and budget experts to develop considerations for budget and expenditure reductions. These include reducing expenditures to focus on essential activities that provide for the public health and safety, as well as community value. We need to also ensure social equity by evaluating the need to support Berkeley's residents, businesses, and community agencies comprehensively rather than on a one-at-a-time basis, so that the limited city resources are distributed fairly and in proportion to the level of need. The city can also leverage current and potential federal and state assistance in a approach to address the community needs. And it's also important to assess for essential services, which includes delaying programs and projects that are not critical at this time. The city can adopt a hiring freeze, consider voluntary separations, and estimate the increases in need given the pandemic. And finally, I wanted to touch on the $36 million in the city's reserves. It's important that we take a long-term view in reserves so that the funding will be available for the duration of the downturn. Our report advises that, one, we can use reserves as part of a plan with defined end dates and a specific goal. Two, to not solely rely on reserves, but use it in combination with other measures to reduce expenditures and mitigate revenue loss. And three, develop multiple scenarios with specific criteria for when and how much of the reserves can be used. In conclusion, we are entering into a tough budgetary period for the city. I hope this information helps shed light on the factors that will impact the budget and provides useful considerations for decision makers. I'll leave you with this. It is critical that we take a comprehensive and long-term approach to addressing our fiscal challenges. We are in a marathon and not a sprint. Thanks for letting me share at today's town hall.
Thank you so much, Auditor Wong, for all your work over the past several weeks to develop this report, which is extremely important as the city of Berkeley begins to plan for its budget for our next fiscal year and also plan for future fiscal years, and to understand what the economic impacts are of COVID-19 and how we can weather this very difficult economic period. So thank you so much for all your work, and I think it provides a good roadmap for us to use as we're beginning to make these very challenging budget decisions. And part of the reason why I wanted you to join us this afternoon is so people understand some of the challenges that we are facing, and that we are not going to go back to business as usual, and that we are going to have to make some difficult decisions. But at the end of the day, it is about prioritizing essential services and the health and safety of our community. So thank you so very much. Just a few things I wanted to update Berkeley residents on before we go to questions. Our city auditor talked about the Berkeley Relief Fund, which, as you know, we launched on March 17th. And this next week, the city will be announcing the first awards of grants to small businesses and to arts organizations. So stay tuned for that information. And we are still seeking funding to help provide additional grants to businesses, arts organizations, and funding for residential tenants. So if you'd like to support our community and help us get through this difficult period, please give at berkeleyrelieffund.org. We are working hard to secure additional county, state, and federal funding. And I want to highlight the fact that the CARES Act did not provide direct funding to local governments. And I was part of a coalition of mayors throughout the country, led by the U.S. Conference of Mayors, that advocated that we get direct funding in the bill that Congress passed this week to ensure that local governments, which are going to see a decrease in revenues, which are already seeing a decrease in revenues, and need money to fund not only public health and emergency response, but essential services, that the federal government will step in like they bailed out big corporations, can provide support for state and local governments responding to this crisis. We will continue to advocate that the federal government provide direct relief to cities like Berkeley to be able to address this crisis, particularly cities of under 500,000 residents, which many cities in the United States are under 500,000 residents. As we've touched upon previously, the council did adopt a moratorium on residential and commercial evictions during the state of emergency. The county took action this past Tuesday to adopt legislation that applies to all cities in Alameda County and in the unincorporated areas of the county, which broadens those protections to all evictions in Alameda County. And so we will be getting information out about the new county ordinance and how that may provide protections for residents who are impacted by COVID-19. Many people have lost their jobs, people have seen a reduction in hours or income, and we do need to provide a safety net so people can stay housed and can get through this period. And we are working to try to provide guidelines for repayment plans for tenants that are not able to pay their rent during this time. And we need to make sure that the protections that we put in place, that they are ongoing protections so that even after the shelter-in-place order is lifted, that we are able to provide eviction and rent protections for people that have been affected by COVID-19. So these are all issues that we are talking about as in the theme of what's next that we are engaging in, and stay tuned for more information. So with that, we're going to go to questions. And I'd like to first direct the questions to the city manager. We have a number of questions. Some of them are very similar and relate to similar topic areas. So I'll do my best to kind of group the questions. So the first question is around communication with Berkeley residents. And this resident suggests that we employ text notifications or other types of automatic push notifications to people's cell phones or emails to disseminate information around health orders and other directives that our residents need to comply with, namely the mask order. I know that we have Nixle and an AC alert, but could you touch a little bit about what sort of means of communication do we have to connect with Berkeley residents, and whether we can look at maybe other options to automatically sort of disseminate information so our community is informed. I know I've gotten a lot of questions about the mask order, the facial covering order in the past week, and I know we're doing our best to get that information out to residents.
Thank you, Mr. Mayor. Yes, that's a really good question, and I think a really good idea in terms of how can we expand notifying individuals in our community about what's going on and when new things happen and change. And the more the more outreach, the better. As you know, we've electrified our social media outlets, of course, but platforms such as Nextdoor, AC Alert, just direct text messaging, those are all incredible pieces. What we'll be looking to do in the near future is mailers. I think one of the things that, just simple postcard type mailers to just get information out quickly to folks. Those can be a little expensive. Sometimes people read that, sometimes they don't, but I still think it's critical that whatever opportunities we have to outreach to our community, we should use those. So social media, neighborhood platforms, things that are established through our Alameda County systems, alert systems, as well as mailers and flyers. So at this point, and of course our city website, which has received multiple thousands of touches from our community. So it is being effective, but not everyone has access and not everyone goes to your website to find out information. So we'll try every opportunity. Thank you.
Thank you. There are a number of questions around homelessness, and this was really a comment. This resident is concerned about the situation along Lower Cordonices Creek, where they're seeing a fast-growing number of homeless individuals camping, and they were wondering if the city would consider outreach as well as putting in sanitation facilities for homeless individuals that are sheltering along Cordonices Creek.
So yes, thank you. One of the things that we just met on recently, I would say within the last 24 hours, is to start assessing what's out there in terms of other non-visible types of encampments. So we will add this to our list, and I want to thank the writer that suggested it, but we are aware of the Cordonices Creek encampments, and we will get out there and make some assessments to see what's going on and what resources are needed for those folks. Thank you.
Thank you very much. I think you touched upon this in your initial comments around the growing number of encampments in our commercial districts, and that the city will be deploying a multi-departmental team that will be going out to assess the needs of people on our streets, to encourage them to comply with our regulations and to address any debris that has accumulated in our commercial districts and public spaces. But with enforcement not being the first step, I just want everyone to know that our priority is to protect the health and safety of our residents. The CDC guidance has actually stated that breaking up 10 encampments has even greater risk of creating community spread. And so our goal is to try to ensure that people can self-isolate as much as possible, with the goal of getting people off the streets and into hotel rooms and into trailers and into larger shelters. That is first and foremost our priority, and we are working very, very hard to address that. But at the same time, we have seen an increase in problematic behavior in downtown and in Telegraph Avenue. And my understanding, Madam City Manager, is that the Berkeley Police Department will be deploying additional patrols in those commercial districts to have more eyes on the street.
And our goal is to make sure that our businesses know that we are there for them and that we are going to support them in this time, and to let the community know that just bad behavior will not be tolerated just because our city is so shut down and it looks like a ghost town, but it is not. We have businesses that are still active, and we will have police support, and also it's more than just police support, because some of these things are around mental health issues and also around available resources for folks. So we want to address it from a very comprehensive approach. So
absolutely. The next question was around people sheltering at the University Avenue on-ramp and off-ramp at Interstate 80. And the question was, when will we house these individuals in hotels, and when will the encampment be cleared? And could you talk a little bit about our ongoing work with Caltrans and the outreach that we've done to the people that are sheltering at the I-80 University, and as well the Gilman off-ramps and on-ramps?
Yes, so three things. Working with Caltrans, as you know, they're a huge entity, so it's been somewhat difficult, but we have managed to have successes with Caltrans. They have a cleanup schedule that's been shared with the city. I believe a few days ago, they will be out and cleaning up the Gilman and the University off-ramp over the next few weeks, and those will be regular ongoing cleanups. So we're looking forward to that. So that's Caltrans, and that's keeping their property clean and safe and getting rid of garbage, debris, and unhealthy conditions. Now for the city, our role is the people. So that's working with the unhoused communities that are out there. And we have been out there on a weekly basis, along with our community advocates that have done a tremendous job in supporting and helping the city to address and reach our unhoused community. We brought information. Of course, education is really important about what's going on. What am I subject to as an unhoused individual? And also for the city to share what we can do to help them. So we've provided everything from food, water, hand sanitizer, additional restrooms and facilities. But the real issue is trying to get folks housed. So while we've been working directly with shelters and moving people out of shelters to address the CDC guidelines, our next move is to start working on those outdoor encampments and moving people off of the streets and into some of the safer ground hotels. And as we lift the hotel in Berkeley at La Quinta, we will plan to house some of our folks there. Most of the unhoused safer ground locations have been for people that are most vulnerable, either COVID-19 positive or I forget the term, but it's I think it's or prescribed positive. I forget the term, but so folks that could likely be positive. So those folks have been the first priority, along with our most vulnerable. So we're going to continue working with all unhoused community folks, but our most vulnerable with critical health conditions and those that are disabled will be our first priorities in movement. But we'll continue the effort, and we're glad to have the partnership with Caltrans, and we'll continue working with them. Thank you.
Thank you very much. These last questions, Madam City Manager, relate to our recreation facilities. This resident asked, we all know that exercise is vital to people being healthy and promoting mental health. When can we expect to reopen our public pools? And I know that really depends on what's next with the shelter-in-place order.
The temperatures are changing,
yeah,
and people are going to want to access their pools. Unfortunately, I don't see that happening anytime soon. While we've done a lot to address the issues around the spread and we've decreased numbers, we're increasing our testing. So we're going to see more numbers and more cases. So because of that, I do not anticipate that our pools will open anytime soon. So we're going to have to rely on other alternative measures for exercise and recreation and getting out there and doing things that are a little bit different. I can't urge people enough to stay home. I know it gets emotionally draining and it's tough and it's hard, but as much as possible, please try to stay home and go out when you can and when you just have to get out and get some fresh air. Thank you.
Thank you. And then lastly, this question asked about the status of the various city camps given the shelter-in-place order.
Absolutely not. So we won't be able to open up the camps. That's, and I'm a camper and my family loves camping and we camp regularly. We are avid campers. I am missing it tremendously, but I want us all to be safe and I want our community and the youth and our families to be safe. So again, I don't see that happening anytime soon, but we will return one day, but it's not anytime soon. But thank you.
Thank you very much. So I'm now going to turn to Dr. Hernandez. There are a number of questions that were asked. The first question is a hat with a shield okay to wear instead of a mask?
We need something that's going to effectively cover the nose and mouth, and the ones with the visor or a shield from the top down does not work. It has to be physically wrapped around and covering the nose and mouth.
Thank you. This next question was, I see many people wearing masks that have exhalation valves, which defeats the purpose of not infecting others. Can the city remind people about not using masks with exhalation valves unless those valves are sealed? I think those are usually sort of masks that people wear when they're doing construction.
Yes, the writer is correct. That is not an effective covering for your face. So I have seen those too, not only in our city, but throughout my travels, throughout from here to home to work, and definitely need to reinforce that that is not a proper covering. So we'll look to encourage. We'll look to communicate that for sure.
Thank you very much. This next question is about nursing homes. I know this is something you touched upon in your initial comments. We all know that nursing homes in our country have taken a very terrible toll. There have been a number of cases of infections as well as people dying. What steps are being taken to protect and care for the residents and staff in our nursing homes? And I know you touched upon this in some of your initial comments, the actual visits that you're doing. And I think, Dr. Hernandez, your video is frozen. I think it might be your internet connection. So I think Dr. Hernandez is going to rejoin us, but while she's joining us again, I just want to highlight what she had touched upon in her initial comments, that our city staff have visited all 6 care facilities in Berkeley and are in ongoing communication and coordination with the staff at our nursing homes and residential care facilities. And those visits included staff in public health. Our health officer herself went out and visited, as well as our fire department. And there's ongoing communication, not only about some of the orders that have been issued around facial coverings, but also and about temperature testing, but also just ongoing coordination. I want to clarify one thing. Actual visits to these nursing homes have been prohibited for quite some time. So I know that was a question last week. And so you are not able to go visit your relative or loved one. And that really it's limited to just staff. And so we are in ongoing communication with those staff about what precautions they need to take to keep their residents and themselves safe. I can answer this next question while Dr. Hernandez is rejoining us. This is about contact tracing. For the 40 confirmed cases in Berkeley, has the city actually contacted their contacts? Can we have any confidence that we would have been contacted if we crossed paths with a confirmed case? As was touched upon by Dr. Hernandez earlier, we do contact tracing, not only interviewing the individual who's tested positive, but all those people that they have contacted. And that's something we've been doing from the very beginning to understand the extent of the spread in our community. And to encourage people to self-quarantine or to get medical care. And so that is something that we're doing. My understanding is the recent bill that was passed in Congress is providing additional funding for testing and contact tracing. So there are additional resources to support our ability to do that. These next questions relate to outreach to and contact with seniors. Who is making sure that senior residences are complying with the shelter-in-place order, such as Redwood Gardens in Berkeley? And Madam City Manager, I think I'll ask you to take that question, because that really has to do with sort of outreach and enforcement. And Madam City Manager, I believe you are muted.
Yes, Mayor, can you repeat the question again? You went out.
It was, who is making sure that senior residences are complying with the shelter-in-place order?
Yes, so our public health staff, working along with our police department and our full city team in terms of how do we address this. Our approach is going to be around education. We're trying to make sure that people are aware of what their responsibilities are, why those responsibilities are necessary and critical that they adhere to them, and have a low-scale police presence here. So we want to come from a perspective of helping folks. So if our police are out there and they're seeing folks that are not utilizing their mask, or they're at a facility where they're not utilizing masks, we want those facilities to require those masks, but we also want our police officers to be out there to provide masks. So say someone doesn't have one or they can't get access to one, we want to be able to support them through that venue. In terms of enforcement, we are not taking a hardcore stand and pursuing misdemeanor violations around the enforcement of not wearing a face covering. However, it is absolutely something that could result. So I don't want to leave people with the idea that it could never happen. I just want them to know that it is not something that we're trying to address in that manner. So we want our public to voluntarily comply with face coverings and making sure that we keep our seniors and everyone safe.
Thank you very much. This next question is around what programs or services are most likely to be cut in a protracted downturn. And this is something our city auditor highlighted. We are beginning to understand what the economic impact of COVID-19 is on our local budget, but we do know we are going to be facing a deficit this next fiscal year, and so we are beginning the conversation actually starting on Monday with the Berkeley City Council's Budget and Finance Policy Committee that will be meeting, and any member of the public is able to participate in that meeting via Zoom or by phone to begin the discussion around looking at the projections that staff is engaged in, looking at our revenues. And I know our city manager and senior executive team is working to develop some recommendations for the city council around how to balance our budget, but also we need to think long-term about, if this is going to be a multi-year recession, what are the steps we need to take, not only to make sure we have an adequate reserve, but also to make sure that we have the resources to prioritize essential services. So long answer that we don't know yet, and we are beginning to have that conversation. I encourage Berkeley residents, if you are interested, to participate in our remote city council meetings to offer your input about what Berkeley should do and how we should prioritize our essential services.
Mayor,
Yes.
if I may, I'd just like to add, there are a few strategies and principles that we're going to be introducing and talking to the Budget and Finance Committee about, of course, and I think it's important to share some of that so that people kind of have a small understanding of a little bit of the approach. For the city, we're going to be looking to taking a look at public health and safety functions, as well as essential municipal services, that we preserve those things to the maximum extent possible. And so we will make every effort to avoid service reductions and things like that. I also think it's going to be important for us to take a deferment first approach by thoroughly assessing our expenditures with a special emphasis on large capital projects and equipment purchases and new projects. And just kind of echoing what you've said is that we just don't know. So we have to start thinking about this in terms of a short-term occurrence, but also in terms of a long-term occurrence, that we could be on this roller coaster for some time. So we'll continue to strive for long-term sustainability, things that align with our resources and with the needs and the city's values. So we want to continue to embrace and commit to things like advancing racial and social equity and serving people who are most in need and being environmentally sustainable. So yeah, we're gonna make sure we bring those things to you all as well.
Thank you. This next question is, why should we continue to pay librarians when all the libraries are closed? I could just say that I know that a number of our city workers are being reassigned to address the COVID-19 crisis. So people that were in other classifications are being reassigned. Literally, I saw a parking enforcement officer providing security in 2180 Milvia just this week. So my understanding is we are with certain positions sort of reassigning them and reclassifying them to provide additional support in a number of areas.
Yes, all of our employees are deemed disaster service workers. They have one classification now, one title. We are all the same title, with the exception of public safety, fire and police, and our public health folks. We're all disaster service workers, so we can be deployed to work in any capacity for which we are trained and able and skilled and safe to do so. So, and we've been deploying those employees, especially libraries. They are the first to, the library director is the first to recommend to support the city in all of our services and resources. And I'm really proud to say that he's been an amazing partner in this effort with us and working through some of the issues. So, yes.
Thank you. And then moving on to the next question. This really had to do with, it really was it wasn't a question, this person was kind of sharing their perspective that they think that the severity of the disease has been wildly blown out of proportion, given the numbers that we're seeing. And the reason that we're seeing significantly less deaths than early predictions warn was due to the shelter-in-place protocols being put in place. They have actually had the effect that was intended to reduce the number of infections and reduce spread. And so this is a real serious threat to the safety of our community, as evidenced by the hundreds of thousands of people that are dying throughout the world. But we are fortunate in the Bay Area, thanks to the leadership of our health officers, that by issuing that shelter-in-place order early, and by us sheltering in place, as difficult as it is on our sanity, and as difficult as it has been on a serious level to our businesses and to many of us, it is having the effect it was intended by helping reduce spread. And so that's why it's so essential that you stay home to save lives. Another question was, when will we hear about whether the shelter-in-place order will be extended? Dr. Hernandez said it is expected that a decision will be made. Decision being made now, and that it will be announced early next week. So expect an announcement early next week. This question was around what can Berkeley do to bring more general testing to the area? As was previously reported, we have our own testing site in partnership with Lifelong Medical Care and with UC Berkeley. And right now we're focusing on first responders, essential staff, and people that don't have access to testing who have tested positive. But I know that there are conversations that looking at expanding the capacity for testing, including testing other essential staff like bus drivers and people that work in grocery stores. And so I know those discussions are ongoing with our fire department, public health staff, and other staff in the city of Berkeley. So we don't have an announcement yet, but I know those conversations are happening, right, Madam City Manager?
Yes, they are. And our goal is to test 1,000 a week, is to get up to that number. And we have multiple partners out there, UC Berkeley, Lifelong, and our internal staff, public health, mental health. So yes, we have, in our fire department, have been just solid partners in getting where we are today, but we want to expand.
Thank you. This last question was very specific around, have the antibody tests available in Berkeley been verified as accurate by authorities such as the FDA? I will send that question to our city health officer, who unfortunately I think had some difficulty with her internet connection, and we can share the answer at our next town hall next week.
On hold, waiting to be let into the call.
Oh, okay. We will take care of that. She's on hold. Okay, so we will, and I see she is there right now. Dr. Hernandez?
Hi there.
Hi.
Can you hear me? I use my phone, so I'm trying to go closer to old school. I apologize. I'm not sure what happened.
No problem. I can't answer a lot of the questions, but there was one last question around whether the antibody tests available in Berkeley have been verified as accurate by authorities such as the FDA. That was a very technical question that I could not answer. And I don't know if you have any information to share on that, or we can report back next week.
I could tell you this. We are actively gathering the information on all the tests that are being offered to City of Berkeley residents within the City of Berkeley, because that is definitely an important question in terms of what tests are out there. We do know there's one test that is FDA approved from one lab. However, there are a number of other options out there in the community that I would consider not as reputable. So we definitely want to be able to provide that information to our residents in terms of which labs, whether it's the PCR test, which is a swabbing test, or if it's the serology test, the blood test for antibodies. So definitely a great question, and I will report back next week.
Thank you. Yeah, and a number of the questions that were asked, I, or the city manager, stepped in, but I reiterated what you had stated at the beginning, which is that the decision about an extension or modification of the shelter-in-place order, those conversations are happening right now, and that you had stated, I believe in your initial comments, that an announcement should be forthcoming this week.
Yes, yes, absolutely.
So
and
they
are yes, stay tuned and know that they are grounded in data, which we're monitoring every day. So that definitely something that we definitely want to provide the information to the community as soon as possible.
Excellent, thank you. I'm going to take these next couple of questions. One question is, why did it take a month for the Berkeley relief funding to get out the door? We actually received over 1,000 applications, which is really an indication of the impact that this crisis has had on our business community. And so, as I had stated, the first checks are expected to be sent out this next week, and we are working to raise funding to do a second round of funding. To date, we've raised $842,000 just from community donations. But we know that, just as evidenced by the over 1,000 businesses that apply, that the need is significant. So please give what you can at berkeleyrelieffund.org. Will the council be considering tax or bond measures on the November ballot? We will actually be talking about this very issue at our city council meeting on Tuesday. And so I encourage you all to tune in. And we had commissioned a community survey in, I believe it was February or March, but we put that on hold given this emergency, the fact that our staff need to focus on responding to this emergency. And so the council will be discussing this Tuesday whether to proceed with the survey, and if so, on what potential measures. So there were a number of things that were contemplated, such as a tax for fire and emergency services, a tax on rideshare companies, a carbon tax, a vacancy tax. But I do think, given this emergency that we're in and the ensuing recession, that we really need to reevaluate and really prioritize on what is necessary and essential. So stay tuned. Question about the construction restrictions. This person has a kitchen and bath project that has been stalled for 6 weeks. They are feeding their family from a microwave and hot plate. I'm very sorry that you don't have a functional kitchen. They would like to understand, when can they proceed with that project. Right now, there are limitations on what kind of construction can happen, but I would imagine that the discussions that are happening regionally around the shelter-in-place order do also involve whether to start phasing in certain types of construction projects. Dr. Hernandez, I don't know if there's anything you could share at this time about that in those regional discussions.
The question about the construction for the kitchen, and I can't remember if it was for the kitchen, that's definitely permissible by the restrictions of shelter in place. It's for home construction can occur for something as specific as health and safety. Being able to have a functioning kitchen it would fall under that category.
Thank you for that.
So I wanted to.
I think there's been some confusion about that out there. So that sounds like that is an essential project. So they should contact the planning department. So for that resident who did write in, Our health officers confirmed that this is a project that is permissible, as it is for health and safety. You should have a functioning kitchen and bathroom. And so they should contact the planning department, Madam City Manager.
Yes, and that's especially if it is the residence for which they're using. So if it's a property that's a commercial property and no one's using it, and it isn't something that's preserving a life activity for someone, then it is not allowed to continue. But if it is truly a residence and you're living in that residence and you need a kitchen in which you cook and provide food or electricity, those types of activities can continue, but you must be living in the home.
And what about seismic work? Like if, we have requirements that owners have to seismically retrofit residential multifamily buildings. Is seismic work also fall under that health and safety?
Yes, the owner is living in the house. Seismic work is, because that's a clear safety issue, but it can't be because there's a declaration of a financial hardship. It has to be about safety and that the work needs to be done. But again, we will inspect, we will send out an inspection to happen, and so that we can determine whether or not the project is essential.
Okay, thank you. I believe we received that question by email, and I did forward it on to our city manager. So hopefully that provided some additional information. And if people have additional questions, please follow up with my office. Because I know this person, they were doing seismic work on their house, and so they weren't able to live in their house. And so so there were just issues around certain construction needing to happen and it impacting their quality of life. So sounds like, I'm sorry.
We have a very detailed response for the homeowner, and we'll be sending that out shortly. But yes, we do have to perform. We have, I believe, performed the inspection and sent out a few emails. So there's been a little bit of back and forth, but we'll continue to work with the homeowner and to work them through. But I believe the specific project that you're talking about does not provide for what they were seeking. So, but we will continue to work with them. Thank you.
Thank you very much. Just a few more questions. How is the city handling the differential and hard-hitting impact of COVID-19 on the Latino community? And I can kind of start my response, and then if Dr. Hernandez or the city manager want to elaborate. I have actually participated in a number of meetings over the past several weeks with some of our nonprofit organizations that work with our Latinx community, as well as with Latino community leaders around outreach, making sure information is available in multiple languages, and better coordination with our school districts, and how we could sort of work in partnership with those nonprofit organizations to get information out there and provide support for our undocumented community and our Latinx community during this time. So I know that there's a lot of discussion happening right now, and we're beginning to sort of develop those partnerships. And I don't know if there's anything else, Dr. Hernandez or Madam City Manager, you might want to add to that.
I can add. Sorry, Madam City Manager, please proceed.
Oh, no, please.
Okay, I wanted to mention what I suggested or mentioned in my report. We too have focused on the Latino population more so than we have earlier. We definitely had our documents in both English and Spanish, but we have done direct outreach to the population starting the week before last, but definitely this week, in terms of having our public health nursing team out in the community, basically approaching individuals, going to businesses, and providing information and answering questions directly face to face. That will continue next week as well. And we also have that nurse triage line, which is available, that's staffed by a nurse that is bilingual. So she is able to speak in English and Spanish, and will be able to help answer questions as well as connect those individuals to either care through lifelong medical care or through testing at the site.
Excellent. Thank you very much. On that nurse triage line, how could people access that line? Is that information on the city's website?
I'll have to check. If it's not, we will put it there. It's definitely on the flyers that we are releasing in the community, and those are they're posted throughout the city. But I will definitely, if it's not there, I'll make sure that it gets posted.
Okay, thank you very much. And one question, an ongoing issue that we've certainly gotten a lot of correspondence about, whether Berkeley is looking at establishing a program, a slow seats program similar to the city of Oakland. There's one thing I want to highlight before our city manager addresses this. In the 1970s, Berkeley was one of the first cities to actually close off residential streets through a system of barriers, which was a very controversial thing. But it was intended to try to reduce cut through traffic to make residential streets safer. And this was actually touched upon in a recent article by John King in the San Francisco Chronicle. So we actually were one of the first cities to implement slow streets way back in the 1970s. But I know that there's been a lot of interest in whether the city would consider temporarily closing some streets in our community to provide greater physical distancing for people who are going outside to get exercise. And I know that our staff are continuing to evaluate that particular suggestion.
So, Mr. Mayor, I've been pretty upfront about the fact that people need to stay at home, and I continuously push that along with our health officer. It's really important for us to find ways to limit our access outdoors, but get out there, but limit it from person to person contact. So we can do a lot of things outdoors. Our streets are pretty much empty. What we're seeing is people that are speeding and using our public roadways in ways that should not continue. And so we have been working with the police department and looking at what things we can do to address that. What our staff are doing right now, and clearly we are all disaster service workers, so we're deploying people in different ways. So our transportation unit doesn't have the capacity to actually implement something very aggressive, such as what Oakland's doing, but we are still researching to determine what can we do. So I don't want to negate it completely, but I want to be open and flexible in finding out how we can move forward in some direction. And I was glad to see the article in the Chronicle as well, showing that Berkeley, we've already done that. And so that's one of those things that people, we tend to forget that we are the first in some arena, and this becomes a new baby, and it's not a new baby. So, but we'll continue looking, we'll continue researching to see what we can do with the staffing capacity that we have, and what we can do with the community, because there are folks that want to work with us to set something up on a voluntary basis. But again, the social distancing, the encouragement to not pull together teams of neighbors to start at, setting up, street closures. I just want to just get us in a space of not doing those things. But thank you for the opportunity to speak on it.
Thank you. And then the last question is around recycling household hazardous waste. So this resident was inquiring about how they can go about recycling household hazardous waste, such as paint cans, oil bottles during the COVID-19 crisis. I know that traditionally people have been able to drop those things off to the transfer station at 2nd and Gilman. Is there a place that people should go to drop off hazardous waste during this period? Knowing that people are doing a lot of home improvement projects and working on their cars as a way to try to stay busy during the shelter-in-place order.
So, Mayor, I don't have an answer for that question today, but what I'd like to do is we can revisit that question, and I can certainly reply to you offline, and we can reply to this individual, but we can bring it back next week so that we can give a good answer for everyone.
Thank you very much. So there were a number of comments around leaf blowers. And my understanding is under local ordinance, gas-powered leaf blowers are prohibited. So if somebody is operating a gas-powered leaf blower, you can report that to the city by calling 311. However, electric leaf blowers, as annoying as they are, and I know this because I was on a conference call and somebody in the property right next to me was doing an electric leaf blower and wasn't blowing much, was just blowing dirt off of the parking lot, and it was very, very annoying. But those are allowed, and I know we're all sheltering in place, and that could be very difficult. One of the things that was asked also is whether leaf blowers can spread or transmit COVID, and as Dr. Hernandez had stated last week, no, it doesn't sort of push or facilitate the spread of the virus. So those were all the questions that we had. I want to take this opportunity to thank Dr. Hernandez, our city manager, our city auditor, for their time. They're incredibly busy, for participating today, to be able to update our community about what we're doing to respond to COVID-19 and to answer your questions. Before we close, I just want to highlight that, as Dr. Hernandez said, the city will be implementing a dashboard to present the data in a more dynamic format. But also today, just in preparation for this town hall, I went to Berkeley side and they have a new dashboard that they have launched. So I encourage local residents to go to Berkeley side to access their dashboard, which is providing on a daily basis updated information on number of cases and other relevant information on COVID-19. So with that, if our panelists want to just make any closing remarks, give them the opportunity. Madam City Manager, anything you'd like to say before we close?
Absolutely. Just, thank you again, Mr. Mayor, and your staff for hosting us on this platform with you. It's always a joy and a pleasure to connect with the Berkeley citizens. And again, I always like to put just a thank you out there to our amazing city staff and our crews and some of the just amazing work that they're doing. It's incredible. We have a lot to do. We know that, but we appreciate the support of the community. We appreciate the support of our auditor, who has been very complimentary to a lot of work that we're doing, and also to Dr. Hernandez, who is handling a massive amount of workload. So thank you all, and I hope you have a great rest of your weekend.
Dr. Hernandez, any closing comments for the Berkeley community you'd like to share?
Sure. Again, I want to thank you too, Mayor Arreguín. It is definitely a great opportunity to connect with the community in a different level. I actually tried it in 2 ways today, since I'm now on phone, and I actually missed the video aspect of the Zoom. So again, thank you very much for that opportunity. I want to appreciate not only the team and the city for helping to respond to this pandemic, but also to the community who's doing such a great job, and continue to keep each other safe as we move forward through this pandemic.
Thank you so much, Dr. Hernandez, for all your amazing work and your leadership during this very difficult time.
My pleasure.
And our city auditor, Jenny Wong, anything you'd like to add before we close? You'd like to share with the Berkeley community?
Yeah, I just wanted to thank you for inviting me to be on this panel today. I appreciate that you are highlighting some of the fiscal challenges ahead, ensuring that the public is hearing about the tough decisions that are going to be facing us in terms of the budget. Want to just also reiterate again that if folks want to join the Budget and Finance Committee meeting to call into Zoom, that's going to be Monday at 10 a.m. I just also want to just thank you for having these town hall meetings every week. I think they're incredibly important in having you and the city manager and the health officer provide weekly updates to the Berkeley community. So thank you. Thank
you very much. Thank you, Berkeley, for tuning in. Please feel free to contact my office, mayor@cityofberkeley.info, if you have any questions or ideas. And want to thank once again to our public health officer, our city manager, and city auditor. I know they're incredibly busy. Really appreciate them taking time out of their weekend to connect with us and to keep us updated. So thank you, and please be safe and enjoy your weekend.